Okay, good afternoon, my amiable listener. There is a challenge that I've observed, which over time I've been ruminating on it, and I felt I should bring it to your awareness. There is a growing concern among people, and what is this? Is because people these days decide to go into self-medication, especially when they have emotional issues. There are stories of people when they have emotional issues like depression and anxiety, without any recommendation from any specialist, because they had X and Y use also medication at a point in time when they have emotional issue. They too will go and buy the same medication and be using it without any recommendation or prescription from any specialist or mental health practitioner. And in most cases, they will tell you that, they had that Uncle Joe, when he had this kind of illness, he was using so medication. And without any specialist recommendation, they start using it, they start abusing such a product. And in most cases, it has never helped. It's either they start gaining weight, or when they start experiencing extrapyramidal side effects, in other words, the side effect of the medication, now the problem become double. And it is important for us to look into this critically, that it's a challenge, especially now when we are in a situation globally when emotional issues is on the increase. A lot of people are coming down with depression, coming down with anxiety, coming down with postpartum depression. So self-medication is injurious. Stop going about and be using medication without being recommended by a specialist. And may I also tell you, there are some emotional issues that does not even require you to use medication. You don't even need to use medication at all. Some level of depression does not even require you to use medication. Some level of emotional issue, you don't even need to swallow any drug at all. Just get in contact with a licensed clinical psychologist, well trained, experienced, and let him give you what is called the talking therapy. Or in other words, they call it cognitive behavioral therapy. The strategies in this talking therapy is enough to take you out of your emotional issue. And that will save you cost, it will save you side effects of the medication, it will even save you a lot of challenges. I've seen several cases in the past of cases that were brought to me to manage, and following assessment, I did tell the parents that, see, this child doesn't need any medication. Talk therapy will do it. Give us 2 months. Within a month or two, you will see the result. And there have been extensive results that when these children or these individuals were exposed to cognitive behavioral therapy strategies and techniques, they come out of their emotional issue and without using medication. So it is important. Knowledge is power, but functional knowledge is more powerful. That when you have emotional issue, or you have a friend in your school, you have a friend or a colleague at work, so many students in the Afritour, sometimes when they have one emotional issue or the other, it could have even been triggered by stress. The next thing they are asking is who has had this kind of condition before, because they want to take the similar medication. It's dangerous. It's dangerous. It is always good to meet specialists when you have emotional issue, and following thorough assessment, the specialist will be able to tell you whether you need medication or otherwise. But I want to assure you that it's good news for you if you are going through one emotional issue or the other. You know someone going through one emotional issue or the other. Talk therapy, which is usually delivered by licensed clinical psychologists, will go a long way in promoting recovery and resilience, bouncing back from that situation, and you'll be fine again. But where medication is necessary, the psychologist will also refer you to meet specialists in that field who will assess you, evaluate you, and recommend appropriate medication. So if you know anyone or you are going through one emotional issue or the other, for example, you are not sleeping well, you are not eating well, you are losing interest in pleasurable activities, and in most cases you are having weeping spell, and your life appear like there is no way forward, you have symptoms of hopelessness, I want to tell you that is not the end of life. You can bounce back of this, you can bounce back out of this, you can be fine again. Consult a licensed clinical psychologist where you go through the session of the talk therapy, and I assure you, all things being equal, with necessary support, you will be fine and you will improve and you come out of this situation and you function well. Are you in need of a therapist? Are you in need of bouncing back? Are you going through an issue that is overwhelming and you need someone that you can talk with, someone that you will listen to you, someone that will give you rapt attention? Do you know, just talking with someone with the assurance of confidentiality will go a long way in helping you to come out of this. You can reach us on this platform. We are always available to assist and to help you and get you to that level of optimal functioning that you have always dreamt of. I wish you a lovely and fantastic day as you listen to this program. Kindly share, like, and subscribe to our YouTube platform. And I tell you that whenever we drop another beautiful content, you will be able to have them at your disposal and you'll be able to watch them, and it will be of tremendous value to you. Thank you as you do so. Thank you as you do. Thank you until we see you again. Have a nice day. Thank you, everyone.